Wichita's #1 news station. This is 2 News at Noon.
Oh, thanks. Well, prostate cancer is the most common cancer in American men, but new guidelines have many men confused on whether they should get screened for prostate cancer, and if so, when. Joining us is Dr. Stephen Lynch. He's a urologist at Intermountain Medical Center. Thank you very much for being with us today. Okay, so let's sort all this out. What about screening?
Okay, so the new guidelines, which were put out by the U.S. Preventive Task Force, stated that prostate cancer screening should not be done, and that's basically PSA screening, which is a blood test.
So what do you think?
Well, prostate cancer is a very common cancer.
Yep.
About 1 out of 6 men get prostate cancer, and a lot of those cancers may not need to be treated. But a lot of men...
But does it hurt to be screened?
Well, I don't think it does hurt to be screened, particularly since it's just a blood test. You're going to be getting your cholesterol checked anyway once a year. This is a blood test, doesn't even require fasting. So a blood test and a physical examination once a year is a very minor thing to do to prevent prostate cancer, or to look for prostate cancer.
So then the decision comes, if you are screened and it's positive, the next step
would be a biopsy.
Or a biopsy, but
Right.
Treatment, whether you should get treatment or not.
Right, and so there are cancers that don't need to be treated, and I would say that somewhere between 25 and 40% of the cancers that are diagnosed aren't treated. And so those men are simply followed, and we follow their PSA, and if the PSA continues to rise, or if they have other features that make it seem like this is not the run-of-the-mill slow-growing prostate cancer, then we would talk to them about treating. But the real decision in my mind is not whether or not to be screened, it's whether or not to be treated if you're diagnosed.
And I don't know what can hurt to, other than the fact that you might have some anxiety over it if you are diagnosed with it, I guess, but...
Right.
It's better, I think, to know than not know.
Well, and if you have a strong family history and you have other family members who've had prostate cancer, you've probably got a fair amount of anxiety in not knowing. And so you probably want to get as much information as you can and then deal with that based on what you've found in your life as far as other family members and how they've behaved with treatment.
Yeah, and especially if you're older, usually you don't treat anyway.
If you don't have a 10-year life expectancy, you don't need to be treated. The average prostate cancer, you could live more than 10 years without treatment.
Yeah. All right. Well, Dr. Stephen Lynch, thank you very much for being with us. For more information, where should people go?
Well, they can come to Intermountain Medical Center, to the urology department there, and we can talk to them. But, you know, really for screening, the best person to talk to is, quite frankly, your family doctor.
Sure.
They're the first line defense on these. They can do all the tests themselves.
All right. Well, thanks for being with us. Appreciate that information. We'll be back right after